What exactly is kidney stone disease?
They cause large stones in both the kidneys, especially in very young children.
Is it that intake of chocolates will cause kidney stones?
It can occur in children, in adults, in elderly age group.
They say that if you drink soda, the urinary stone will get passed off.
But what exactly is the adequate amount of water? How much water should I drink?
What are the red flag signals that you advise the patient? If you see the symptom, come immediately to the doctor.
Because larger stones, the more bigger it gets, it is more difficult to pass spontaneously.
We heard something called as laser for kidney stone, which is actually shocking.
Jai Shri Gurudev. Namaste and welcome to BGSMCH Aarogya.
Your health, our priority. I'm your host, Dr. Anu, and in this episode of Aarogya Vani, we will be discussing a very important disease, kidney stones, a disease that can present with excruciating pain, and if ignored, it can lead on to serious complications. Let us try to understand the disease, what causes it, what are the symptoms, what are the treatment options available, how we can prevent. To help us understand about this disease better, we have with us today our expert from BGS Medical College Hospital, Dr. Suraj Muralidhar, urologist, andrologist and transplant surgeon. Hello Dr. Suraj, a very warm welcome to BGSMCH Aarogya Vani.
Thank you so much for providing me this opportunity to speak today. I hope our discussion will be informative, interesting and also fun to watch.
Yes, Dr. Suraj. Being a neurologist, what type of patients or with what diseases does patients usually approach you?
Usually day to day we see patients who are having problems in their kidneys, in their bladder, prostate, testis, etc. But the most common type of diseases which I come across every day, one is the urinary stones and one is the prostate enlargement.
Okay, so you mentioned about kidney stones. What exactly is kidney stone disease?
Basically, kidney stones are nothing but deposition of certain minerals and salts within the urine. If at all the content of water in the urine decreases, the urine becomes more concentrated and all the salts which are present in the urine, they precipitate, forming the crystals. These crystals initially can be small in size, however they slowly grow and they become much larger, forming larger stones.
Deposition of salts as well as a concentrated urine causes kidney stones, right? What are the factors that are leading on to this process of concentration of the urine or deposition of minerals?
The most important risk factors in the formation of these stones is dehydration. If a person consumes very less amount of water, then the urine becomes concentrated and the amount of salts in the urine which are dissolved, that increases and they can actually precipitate to form the stones. So hence, dehydration is the most important risk factor. There are also certain other dietary factors which are important. Consuming excess amount of salts, certain oxalate-rich foods like nuts, chocolates, spinach, if they are consumed in excess quantities, tomatoes, red meat, they all increase the risk of stone formation. Also, taking large amounts of protein supplements is a very high risk factor for formation of kidney stones and kidney damage. I can quote you an example of one of my patients who was a bodybuilder and a film actor. He was consuming a large amount of proteins every day to maintain his muscles. And this actually caused a lot of kidney stones and he presented with multiple stones in both the kidneys. So it's also a very high risk factor.
So you mentioned about dehydration as well as dietary factors. Is there any other risk factor or factor responsible for formation of kidney stones?
Definitely. There are certain medical conditions like hyperparathyroidism, wherein there is increased amount of calcium which causes the stones, and certain other genetic factors also play a role, especially in children when they present with large multiple bilateral stones. So it is associated with certain metabolic disorders which can be genetic as well.
Okay, something interesting that I noted from your reply was that some diet factors contribute to formation of kidney stones. And one thing you mentioned was chocolates, which is actually shocking. Is it that intake of chocolates will cause kidney stones?
Not exactly. Anything which is taken in a small, moderate quantities will not harm much. But whereas if they are taken in very high quantities, they can actually act as a risk factor for some types of stones.
Okay, so any diet in moderation is fine.
Definitely.
Yes.
And also there are certain foods like certain soda or sugary drinks which have increased amount of dissolved salts. So they actually increase the risk of stones.
This is interesting because we have all heard from the community that someone will take excess soda for actually getting relieved of the kidney stones. They say that if you drink soda, the urinary stone will get passed off. But is that correct or is it?
Not exactly. For certain smaller stones, increased water intake, any thing which has increased amount of water is essential. Whereas in certain soda and sugary drinks, what happens is along with the water content, they also have increased amount of dissolved salts. So these actually increase the risk of stones. Whereas increased water is actually beneficial for prevention of stones.
So drink more water rather than soda or any other aerated sugary drinks.
Yes.
It can cause many other diseases as well, and it is contributing to kidney stone as well.
Yes, exactly. And many patients, they come and ask, okay, you have advised me to drink adequate amount of water, but what exactly is the adequate amount of water? How much water should I drink?
Yes.
So it depends on the type of profession, the day-to-day work what you are doing, because each person has a different limit which says that this amount of water is adequate. I can give you an example. A manual laborer who is working out in the hot sun, he sweats daily and then he works in the hot sun for hours together. For him, he will require a larger amount of water for it to be called as adequate. Whereas an IT professional who is sitting in a small AC chamber, who travels by an AC car, who sits whole day and hardly walks around, he might require a lesser amount of water for which we call as adequate. So to say that for a person, how much water is adequate, we should ask him to see the color of his urine. If that is very close to the consistency of water, that means to say that he is drinking adequate, sufficient amount of water. If it is very much dark yellow, dark orange in color, that means that he is dehydrated and he needs to consume more water.
Okay, that was very insightful because we usually quote one range 3 liter to 5 liter per day.
That is for an average person who is doing an average physical activity. Around 3 to 4 liters is considered sufficient.
Okay. Is there any age preponderance like kidney stones affect mainly the older individual, anything like that?
There is a common myth in the common public that kidney stones usually affect only the adults, whereas the children are considered to be safe. Definitely no, because certain metabolic disorders, as I mentioned earlier, which have a genetic tendency, they cause large stones in both the kidneys, especially in very young children. So there is no age group where we can say they are safe and they cannot have the stones. It can occur in children, in adults, in elderly age group. In all the age groups, the stone can occur.
So anyone can get the disease?
Anyone can get the stones.
Okay. How does a patient present to you with kidney stone? What are the symptoms of kidney stone disease?
Most commonly, a patient who is having a kidney stone, he will present with pain in the side of the abdomen, what we call as flank pain, usually originates towards the back and it can radiate towards the groin area. So that is the commonest symptom which the patient will present. He can also have certain other symptoms like vomiting, burning sensation in the urine, and sometimes even blood in the urine. So these are all the common symptoms with which the patient with a stone disease will present.
Pain in the abdomen, painful micturition or painful urination, as well as even blood in the urine, right? What are the red flag signals that you advise the patient? If you see the symptom, come immediately to the doctor.
The red flag signs, you can say that sudden, severe, excruciating flank pain. Patients with this will present to you even in midnight, and if there is frank blood in the urine, so immediately visit the doctor, don't delay.
Because kidney stone is a disease where people having very small size stone, they will live with the stone without consulting a doctor for years together. So this is the most important point that you have discussed: excruciating pain and blood in urine. So immediately rush to your doctor, right? How do you diagnose this disease?
Usually, whenever a patient presents with these symptoms, the first thing we use to diagnose the stone disease is to get an ultrasound scan. So when we get an ultrasound scan, we will get to know an approximate size of the stone, approximately where it is present, we will have an idea. But however, we cannot take that as the exact size of the stone, because there are a lot of factors in ultrasound scan which prevent in measuring the exact size and dimension. Sometimes there will be some other organs like the intestine which is coming in the way. Sometimes there is some gas which is obscuring the stone, or so many other factors. So ultrasound, we just get an idea as to how many stones or where exactly is the stone and approximately how big is the stone. To know the exact details, it is always preferable to get a CT scan. A plain CT scan will tell you the exact dimensions of the stones, where exactly the stone is present, and even the density of the stone, because this is very important in which modality of treatment we need to cure this disease.
Okay, this might be the reason why people will take ultrasound scan every week and they find different size of their stones, and they might think that whatever they are doing, adjusting with their daily routines like drinking more water or might be some other medicines that might be taking, is causing a drastic change in the size. This might be the same mistake or the error that is there with the ultrasound, that in different dimensions it can show different size.
Exactly, perfectly said. The ultrasound scan, how it works is, it just takes one section and then gives us the dimension in one particular direction. A stone is not like a ball which is equal in all the directions. A stone is more irregular in shape, it has sharp edges, it is irregular, sometimes even cylindrical. So in one dimension it can measure 4 to 5 millimeter, in the other dimension it can measure 7 or 8 millimeter. So you just cannot take the ultrasound measurement as the exact size of the stone and proceed further. You have to consider all the factors like the clinical symptoms, the CT scan findings, and whether there is improving with other modalities, and everything is taken into consideration to see how to proceed with the management.
So, if a patient presents you with the stated symptoms, that is pain or urinary tract infections or painful urination, and you get an ultrasound scan, you find a stone, you confirm the diagnosis. But what about an incidental finding in an ultrasound? Like a patient would have gone for an obstetric scan. When a lady is pregnant, they undergo scans, multiple scans. In one of the scan, if they find that they have some kidney stone, what will be your approach for that?
First thing, what I would like to advise to all my patients and the common public, whether it is an incidental finding or whether it is a ultrasound scan done for diagnosing the kidney stone, so whenever it is found, immediately consult your doctor. The urologist will decide what type of management you need to undergo further. Never take a decision on your own thinking probably this is a small stone, shall I wait till before going to the doctor. So that will be decided by the doctor and not by the patient. So any sort of stone which is diagnosed incidentally, first you visit the doctor. Most of the times what happens is smaller stones which are maybe 2-3 millimeters in diameter, which is not causing any of the symptoms and not causing any obstruction to the urine. We can wait by having more water and then diuretics and pain management, so that these very small stones can pass spontaneously. But however, it should not be decided by the patient himself. It should be under the supervision of the doctor. So any stone which you diagnose, immediately consult your doctor for further management.
You already mentioned about some treatment about the urinary stones. Let us discuss that in detail. What are the treatment options available for kidney stone disease?
So first of all, when we have to decide regarding the treatment for a particular stone, we have to consider various factors. First and foremost, how many stones are there, and then what is the size of the stone, what is the location of the stone, and also the density of the stone. So depending on all these factors, and also the patient factors like how old is the patient, whether he is having any other diabetes, hypertension and other risk factors, whether it is a child. So depending on all these factors, collectively the doctor will decide this particular type of treatment is ideal for this particular type of stone. There is nothing like one standard treatment for all types of stone in all types of patients. First, coming to the very small stones which are measuring say 2-3 millimeters in diameter, basically less than 5 millimeters in diameter. Usually what happens, patients are minimally symptomatic, they usually do not cause any obstruction to the urinary tract. For such kind of stone, the initial management, what the doctor would advise you is to have plenty of water, have diuretics, and also give pain management tablets. So these are sufficient for clearing very small stones. And however, even during this treatment, the doctor has to monitor the symptoms of the patient. If at all, if it is worsening, he has to change the type of treatment. For larger stones, which actually cause urinary obstruction and cause severe symptoms like pain or blood in urine or any burning sensation, all these which I have mentioned. So for this, it is always preferable to get it cleared than waiting for it to pass spontaneously, because larger stones, the more bigger it gets, it is more difficult to pass spontaneously. And even when they pass spontaneously, the larger stones cause significant damage to the neighboring structures when they are passing, including the urinary tube, which might have long-term effects. So in such cases, it is always better to intervene, clear the stone, and then patient also will be safe, his kidney will be safe, the urinary tubes are safe.
So from this, I want to stress the point that it's not the patient who decides. It is always the doctor. So once you, even as an incidental finding, get a report that you are having kidney stone disease, just consult your urologist and then take an opinion, and might be medical treatment or surgical treatment, whatever the doctor should advise. And even how long the patient can wait also might be you will suggest. Okay, you already focused and discussed about the medical management regarding kidney stone disease. Can you explain a bit about the surgical treatments that are available?
Yeah, so before I discuss regarding the various surgical modalities, you mentioned a very interesting point, how long the patient can wait. It is very, very important question, because I have seen a few incidences in my daily practice. One patient will come, he is having an obstructive large ureteric stone, so which is causing obstruction to the urine and also swelling of the kidneys. I would have advised him to undergo the procedure, surgery immediately and get his stone cleared. He will have a lot of issues, like it can be financial issues, it can be some other family problems, he will be having some important wedding or some other function in the family, or some patient, some would have had some health issues of his family members or some death in the family due to various issues. He will think, okay, I will delay it for another 1 week, 2 weeks, like that. So what has happened, he comes back after 2-3 weeks telling, okay, now he is ready to undergo the stone surgery. In the meanwhile, what would have happened, the kidney would have swollen to such an extent that the entire kidney would have become non-functional in those 2 to 3 weeks. So at that point of time, there is no use in clearing the stone. He has to undergo the surgery to remove the kidney itself. So very important point is that in case of large stones which are causing obstruction and the swelling of the kidney, it is always dangerous to wait for a long time, because the kidney can get damaged to such an extent that the kidney can even become non-functional. Okay. So in such cases, always better to undergo the surgery first. Now, as you mentioned, coming to the different types of surgical management, nowadays a lot of options are available for the kidney stone treatment. So the first and foremost, without surgery, there is an option called as ESWL, wherein the ESWL machine is available, and using ultrasound or C-arm guidance, the shock waves, they are focused to the stone, and then the stones are broken down.
This is what commonly called as sound therapy, I think.
Exactly. Yes. So here, however, it cannot be used for all types of stones. It's not useful for very soft or very hard stones. It is not useful for a very small or a very large stone. So an average sized, average hard stone in the kidney, this type of modality is helpful. For different sizes of stones, there are different other types of surgeries which are available. So as I mentioned earlier about obstructive ureteric stone, which is blocking the urinary tube, we go with a camera which is called as a ureteroscope. We go into the bladder, into the ureter, which is a very small caliber telescope. So using that, through the urinary tube itself, we enter the region where the stone is present. We use various modalities to break the stone into smaller pieces, put a stent, and then come out, and the patient is very happy. He can go home the next day. There is no cutting of the abdomen, there is no scar, very minimal morbidity, and we can do it multiple number of times. So that is the major advantage of doing an endoscopic surgery like URSL.
So you explained to us about the surgical treatment of kidney stone disease. Is there any recent advances in the surgical modalities that are available? Because we heard something called as laser for kidney stone. Can you please explain about that?
Nowadays, lot of technological advancements have happened in the treatment of this stone disease. So as you mentioned, Laser is one of the very commonly used technique nowadays to treat the kidney stones. For a URSL, like we go into the ureter and we go near the stone, we use this laser to completely powder the stone and then put a stent. So this powder just flushes along with the urine. Even if there is a stone inside the kidney, inside one of the smallest branches, we can go till there using a flexible scope, which has a very narrow caliber, and we go from the urethra into the bladder, into the ureter, and directly into the kidney. And there we can approach each and every small branch inside the kidney, locate the stone, and this laser fiber is just like the size of a hair strand. So it is so thin, it can be put into the scope, the flexible scope, and then using that we can completely powder the stone and then clear it. And there are certain other management methods as well. For example, a large stone, which is commonly called as a staghorn stone, it would have occupied the entire kidney. For that, what we do, we make a small hole at the back and then go into the kidney and then remove the entire stone in small pieces.
So you explained that even for a big stone, you can just do it with a small hole and then you'll break down the stone and then take it out, right? So initially we used to hear about open surgeries to remove kidney stone. Is it still practiced or open surgeries are not there anymore?
Yes, it is still there. Open or laparoscopic surgery like pyelolithotomy or ureterolithotomy, we can do that only if all of these other modalities are not available or not feasible. Then very rarely it is done. Commonly, all these endoscopic and laser surgeries are done for all the patients.
Okay. In most of the cases, these advanced surgeries will be better and sufficient.
Yes.
Okay. So, since surgery is the major modality of treatment in kidney stone disease, one major concern is the finances involved. You already told that one patient delayed the surgery because of some financial problems. Is it covered under insurance?
Yes, definitely. All types of stone surgeries which I mentioned now, everything is covered under insurance. So I would like to advise all our viewers, those who have still not yet got their health insurance done, kindly get it done for yourself and all your family members, because we never know at what age group who will be affected by this kidney stone disease. So it is definitely covered and they can get treatment at their desired place and their desired doctor, and any procedure if at all they have an insurance.
So in community when we go, there is a common belief that because these stones are made up of calcium, people tend to stay away from calcium. Especially when we advise calcium tablets to females or any other older age group who are at a higher requirement of calcium. At that time when we advise, they usually tend to stay away because saying that it will cause kidney stones. What is your take on this, Dr. Suraj? Is it true?
Definitely, we don't advise them to completely avoid taking calcium intake. Calcium is very much required for certain general metabolism and a good bone health. So whatever is the required amount of calcium with adequate hydration is essential for all the people. However, we should avoid taking too much in excess, which might actually cause the increased calcium.
Now we explained about the treatment options available for kidney stone. Is there a way to prevent this disease? Because for every disease we say that prevention is better than cure. So is there a way to prevent kidney stone formation?
Yes, definitely. There are a lot of methods by which you can prevent the formation of kidney stones. First and foremost, as I have repeatedly mentioned, stay well hydrated. So average of around maybe 3 liters per day of water will keep you well hydrated and then prevents the formation of this crystallization and formation of kidney stones. Also have a balanced diet. Everything in moderation and all the various nutrients in a balanced diet is always beneficial in preventing the kidney stones. Less intake of salt and avoid taking certain very high concentration of proteins or supplements, and then regular walking and exercises. They also help in boosting the metabolism and even in overall well-being and general good health. So I hope everybody follows these simple techniques.
Always prevention is better than cure. So focus on your diet. Everything in moderation is the key. To conclude, Dr. Suraj, is there any take-home message you want to provide to our viewers?
Yeah, as a take-home message, I would like to advise all of you, stay well hydrated, have a balanced diet, do regular exercises, maintain your general overall well-being, and if at all you develop any symptoms pertaining to kidney stones, like let it be flank pain, urinary symptoms like burning sensation, or a lower abdominal pain, immediately visit your urologist and get the investigations done. And if at all you are advised certain treatment modalities, kindly follow it properly without delaying and causing unnecessary complications.
Thanks a lot, Dr. Suraj, to taking out time from your very busy schedule and spending time with us to actually create awareness in the community about very important disease, kidney stone disease. Thank you. Thanks a lot.
Thank you so much.
Dear listeners, hope you had an enriching session. Now you know what are the causes, what are the symptoms of kidney stone disease, what are the treatment options available, how it can be prevented. But one message that I want to stress upon is that if you know that you are having kidney stone disease, please consult your urologist. Take opinion. Whatever you are doing, let it be you need a waiting period, or you want to opt for a medical treatment, or you want to opt for a surgical treatment, leave it to the doctors. Let doctors take the decision for you. With that, we have reached the conclusion to this episode of BGSMCH Aarogya Vani. Your health, our priority. If you found this video informative, please do like, share and subscribe to our BGSMCH YouTube channel. Stay safe, stay informed. This is your host, Dr. Anu, signing off. Jai Shri Gurudev.
If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and hit that subscribe button for more exciting content.